light on who is pulling us back. We have also seen a sustained push for full reopening of the courts. While we know that the courts serve a very important function in this country, we regret that this is not the time to pull back. We want to thank the Judiciary through the Chief Justice Honorable David Maraga for exercising restraint in handling this matter. The health and safety of our court users comes first. Otherwise, there will be no one to dispense justice to. We further appeal to our lawyers to take into full consideration the enormity of the danger facing all of us. We are delighted that the lawyers have been good partners in these efforts, and we hope they will continue to support the country's containment efforts. We also want to thank the Judiciary for supporting the fight against COVID-19 pandemic. We greatly appreciate yesterday's court decision that upheld the measures put in place by the government, including social distancing and fumigation of public premises. We want to urge our people to be patient while we work to eradicate the spread of this virus. Earlier this week, we emphasized the importance of healthy living. It is important to note that people with non-communicable diseases such as heart diseases, hypertension, diabetes, cancer, chronic respiratory disorders, among other non-communicable diseases, are more susceptible to contracting COVID-19 disease. We urge persons with these conditions to follow all the precautionary measures for preventing COVID-19 with great discipline. Adopting a healthy lifestyle is important now more than ever before. A healthy lifestyle will ensure that the body functions better and improves the immune system. Eating healthy diets with plenty of fruits and vegetables, keeping physically active, quitting smoking, limiting or avoiding alcohol intake, and getting enough sleep are key components of a healthy lifestyle. My counterpart in agriculture will shortly provide further guidelines on nutrition. We are continuing to scale up our testing with full awareness that it is only through testing that we can know the scope and extent of our problem. In the last 24 hours, we have tested 946 samples across 12 counties. This brings to 16,738 the total number of tests conducted so far. From these latest tests, 16 persons have tested positive for COVID-19 disease. We therefore now have a total of 336 confirmed cases in the country. These 16 positive were picked out from among communities by our surveillance teams. Of these, 11 were in Nairobi and 5 in Mombasa. The 11 Nairobi cases are spread between the following neighborhoods: Dandora, 5, City Park, 2, Eastleigh, 1, Parklands, 2, and Pipeline, 1. Mombasa's 5 cases are in Kiembeni, 1, Centi Kumi, 1, Stadium, 1, Msikiti Nuru, 1, and Mulaloni, 1. The number of fatalities arising from COVID-19 disease has remained 14 since April 18th. We are most grateful, first of all, to God the Almighty and to the medics and health workers taking care of our patients. We are currently monitoring 887 contacts relating to these cases, and we hope they will not produce many more cases. We have a distribution of samples tested in the last 24 hours by county of origin, that is the 946 that were tested in the last 24 hours. 532 of these were from Nairobi County, 27 from Kilifi County, 1 from Taita Taveta, 312 from Mombasa, 15 from Kwale, 5 from Kisumu, 17 from Siaya, 4 from Bungoma, 1 from Bomet, 15 from Mandera, 15 from Vihiga, 1 from Kisii, 1 from Busia. We have 5 discharges today, which brings to 95 the total number of people who have recovered from the disease. I'd like to stop there and thank you and invite my counterpart, CAS Anyaga, to give her remarks.
Thank you, CAS. Just as mentioned by the CAS, the Ministry of Agriculture will give its remarks with regards to the launch of the guidelines to embed nutrition security in the COVID-19 national response. Good nutrition is very important during and after an infection. Infections take a toll on the body, especially when these cause fever. The body needs extra energy and nutrients. Therefore, maintaining a healthy diet is very important during the COVID-19 pandemic. While no foods or dietary supplements can prevent COVID-19 infection, maintaining a healthy diet is an important part of supporting a strong immune system. The Ministry of Agriculture has been supporting the Ministry of Health in the prevention of further spread of COVID-19. And I would like to take this opportunity to acknowledge our first responders, especially our veterinary officers who have been working tirelessly alongside our health counterparts to implement the One Health approach. Other than the coronavirus, 65% of diseases sending us to hospital today are zoonotic. Our health animal experts have been working hard to prevent similar pandemics from happening, as well as sharing their studies with the Ministry of Health and other experts working toward finding a cure or vaccine for COVID-19. Today, we are releasing the National COVID-19 Nutrition and Healthy Diet Guidelines. I would like to extend, as we do this, a special thank you to our Agri-Nutrition Unit in the Ministry of Agriculture, supported by the Food and Agriculture Organization of the United Nations and other development partners who have worked tirelessly alongside the Ministry of Health and the county government to develop these guidelines. This is part of our strategy to intensify the war against COVID-19. Ladies and gentlemen, we as a nation must urgently address the following. 1, we must ensure that every household consumes a healthy diet during the COVID-19 pandemic. This will go a long way in ensuring that our citizens, especially our youth, who currently comprise the highest number of infected patients, recover quickly if infected. To this end, the guidelines will facilitate 1, a recipe for healthy snacks. Ladies and gentlemen, in recent decades, we have dramatically changed our diets and eating habits as a result of globalization, urbanization, and income growth. We have moved from seasonal and locally produced dishes to high-calorie diets, which are high in refined starches, sugars, salts, and processed foods. Less time is spent in preparing meals at home, and consumers, especially those in urban areas such as Nairobi and Mombasa, are increasingly relying on supermarkets and fast food outlets, street food vendors, and takeaway restaurants. A combination of unhealthy diets and lifestyles that have set obesity rates soaring in Kenya today. Our food security challenge, therefore, is comprised of strategies to combat hunger and malnutrition in some part of the country, and obesity and also form of malnutrition in others. Dear Kenya, COVID-19 has called our urgent attention to the general state of our homes and especially that of our kitchens. We now call upon Kenyans to take a proactive approach in radically changing our lifestyles to adopt healthier diets. To facilitate this, the government today is launching a campaign for 1 million households to establish kitchen vegetable gardens. We have issued guidelines to support both rural and urban dwellers with simple technologies for setting up these gardens within the resources available. With the support of the county governments, we will be distributing the kitchen garden starter kits to assist the most vulnerable households who are willing to adopt this through our programs called KSAP and NARIC. KSAP stands for Kenya Climate Smart Agricultural Program, and NARIC stands for National Inclusive Growth Project across the 47 counties. So for Mombasa and Nairobi, which is not included in these counties, we are partnering with the Ministry of Interior and to distribute through the Nyumba Kumi platform, and also the Ministry of Devolution through the Social Safety Net platform. We therefore call upon the more able household to take up this initiative and use guidelines to set up gardens upon their balconies, within their estates and their home gardens and compounds. The private sector has already made a contribution of more than 250,000 starter kits, and we want to welcome more partners to come on board as we roll out this national campaign on adoption of healthy diets. 2, reduction of food loss and wastage. The ministry is calling national attention to the issue of food loss and wastage. Earlier this month, we released guidelines and protocols to facilitate the supply chain actors in maintaining a steady flow of food to markets all across the country. We have, however, continued to receive numerous complaints from farmers and vendors who have not been able to easily access markets or their farms, and we are working with the relevant stakeholders to find a solution to this. We thank the public for always constantly reaching out to raise a red flag when they are stuck through our hotline. Our hotline is good to note our hotline so that if anyone is stuck at this particular time, they can be able to call us and we are able to sort out the issue that they may be having. So our hotline is 0800-724-891. I'll repeat, 0800-724-891. Our teams are working round the clock to respond. We, however, would like to retaliate that the ministry is committed to ensuring that all the value chains in the agricultural sector fully comply with the set protocols. We would not like to see a scenario where our food supply chain becomes responsible for an upsurge of new infections. Therefore, we call upon our stakeholders to work with us to fix the emerging issues, and especially our police and public health enforcement officers to take a more facilitative as opposed to a more punitive approach when handling our food transporters and vendors. 3, availability of food throughout the pandemic and afterwards. Ladies and gentlemen, we have put adequate measures to ensure the availability and accessibility of our national food staples. These range from cassava, maize, rice, wheat, beans, Irish potatoes, matoke, sorghum, millet, green grams, milk, meat, including poultry and fish, and local vegetables. We are closely monitoring the status of our farms and the market flows, and we will continue to update you on this issue. We understand the anxiety that many Kenyans have around food matters, and we want to take this opportunity to reassure you that the Food Security War Room will continue to monitor and swiftly respond to any challenges that may be forthcoming. Ladies and gentlemen, the Kenyan farmer is one of the most important people today. It is the farmer we are depending on to go to the farm and continue producing food while we stay safe at home. I would like to call upon the nation to celebrate our heroes today and even beyond for this important work that they continue to do to ensure our food and nutrition security during the global pandemic. Our agriculture economy will also be pivotal to our national economic recovery beyond COVID-19. This is why we will be using this opportunity to engage our young people, that is our youth, to join the agricultural workforce, bringing the innovations and talents to assist in transforming this crucial sector. We encourage parents to begin teaching their children during this period when they're at home to have a better appreciation of where their food comes from. They should also be encouraged to play an active role in setting up these kitchen gardens that we are about to establish. Finally, I would like to thank the Ministry of Health for its continued efforts and state that the Ministry of Agriculture, Fisheries and Livestock and Cooperatives is fully committed to play its role towards flattening the curve. Thank you.
TV. Maybe Bona PS, maybe the 30 days, the CS, the 30 days curfew maybe will be coming to an end by tomorrow. Maybe as a government, are you maybe planning to extend the curfew order? Yeah.
My name is Chemutai going from Citizen TV. Oxford University just commenced trials on a possible coronavirus vaccine. Of course, tests are still being carried out, but the scientists say they are considering Africa as they widen the scope. And in Africa, they're actually considering Kenya because to them, it has a low rate of infection. Has the Kenyan government possibly been contacted regarding this, and possibly what is the position regarding this suggestion?
I'm Nancy Okware from KBC, and we've received reports that there are some truck drivers who tested positive for coronavirus in Uganda. Is this true? And if yes, what are you doing to ensure that the people they may have contacted in the country before they actually went to Uganda are traced?
My name is from NTV. My question basically is about the curfew, the ongoing curfew. There's been a lot of concerns that people who've been found to flout the curfew or the regulations set down by the government are put into quarantine facilities and not detention centers. Maybe you could comment on that, because the reasoning that we have is that quarantine facilities are supposed to be for those who are suspected to be having viruses. Yet these ones who've been caught flouting regulations and rules of curfew and all that do not necessarily have the virus and all that.
To the expiry of the original 1-month curfew period. As I said in my statement, we are on the penultimate date. This is just a day or so before the expiry of this time. And this is a matter, of course, that I'm sure is being discussed at various levels. That period has not come as of today, but I'm sure that by the time it comes or just before that, there will be some form of communication on the position of government regarding the curfew. The second question was from Chemtai of Citizen, and you inquired about the Oxford University vaccine trial. I have equally read this in some of the media spots. As a government, we are not aware at all about the interest of this team to come and work with the government of Kenya in testing this vaccine. We are not aware. There are proper laid down procedures for engagement of this nature. Equally, there are proper laid down procedures, rigorous procedures of review, ethical review, and approvals of any clinical trials whatsoever. And we have a very robust structure here under the Pharmacy and Poisons Board that is responsible for regulating and reviewing clinical trials. So at this point, we do not have any information on this. And if this request does come to us, it will be subjected to the appropriate scrutiny before government responds to it. KBC asked a question on truck drivers from Kenya that are entering Uganda. And the government of Uganda has reported that they have tested, I believe it is 5 now, of these truck drivers as being positive. I was out in the border points early this week with a team of government officials from several ministries to look at the border points and assess them. What is happening right now is that on the Ugandan side, truckers entering from Kenya into Uganda are being screened and tested for COVID on the Uganda side, which has also created some logistical problems, as you are aware. And these results, I think, are coming from that screening. But in the spirit of the East African community and cooperation, and this being a pandemic that does not know any border, we are collaborating and sharing information. So that kind of information is available to us. As it is made available to us, we then can be able to begin the contact tracing as well. At the same time, as we are ramping up our testing, we've been talking about targeted, expanded testing. We will also be probably doing the same thing in terms of testing truckers that may be coming into the country, and we are again going to discuss with our neighbors in how best we can do this without really interrupting the flow of traffic and goods. But the final question was regarding the issue of quarantining those found breaking the curfew law. If I'm not mistaken, I think that is what you asked, yes. And I know that it also came up yesterday, and how, as a government, we are dealing with it. As it stands now, it is a directive that anybody who flouts the curfew will be put in quarantine, mandatory quarantine for 14 days. It is necessary that these regulations are followed and adhered to, because it is the only way that we will be able to break this cycle of transmission. And of course, it has to be enforced. The question, I think, is more about mixing people who may not necessarily be positive with those that might be positive in quarantine facilities. Remember, in quarantine facilities, we put people in there if, one, they have a travel history, or if they have been in contact with any of the confirmed cases. So even those who are in quarantine, quite a number of them may not actually be positive, but they are put there so that we give time to be able to determine and sift out those who are positive from those who are not positive. But that issue, I think, when the time comes, there will be a position on it, but for now the position is that if you break the curfew, you will be in a 14-day mandatory quarantine. Thank you.
Next on.
Hey!
Huh? What?
Mnaenda wapi?
Kwa na mapinduzi ya biashara mitandaoni.
Ndio vizuri.
Super mashine ya kuzuia bidhaa mitandaoni. Mke wa bosi. Hii ndio bidhaa ya kimapinduzi ambayo kampuni yako itafanikisha.
Wewe unafanya nini?
Nimesema sana hapa, uvimu nisikia, unashughulikia mambo yako tu.
Si mashine ya kuuzia bidhaa moja kwa moja kama vile sokoni.
Unanidharau, nilichokisema ni ya mtandaoni.
Tamu sana.
Kweli, kaona ladha nzuri sana.
Kweli uliwachinja?
Ndio.
Next on.
Hizi wanaume na wake ni hivi sambamba. Mkipiga hatua na sisi tupiga hatua. Kuna mizigo yenu yafanana, kwani mtu kama ali pamoja?
Hata mimi simjui bwana. Mimi nimetoka kufanya shopping ya mtoto wangu amezaliwa jana.
Hata mimi basi nitoka kufanya shopping ya mtoto wangu pia wa kiume kama ulivyokuwa naomba tu kabisa. Hata tuona mtoto wangu kwanza, alafu tutaandamana tukamwone mtoto wangu.
Wacha tuone wangu kwanza kisha tukamuone wako.
Mimi shafika tayari.
Hata mimi shafika na ngoja mtoto aamshwe.
What is your end goal here?
Nothing, sis.
Sis, excuse me.
What? I will channel na Mungu.
Why did you look for a mole? I believe in a strong family setup. Nini mbaya?
Kuna shida madam. Nimepiga simu nyingine.
The company you're working for is my company. And you've got permission to be late.
Really? Because I thought I answered to a totally different person.
You can put in your number there.
Cool.
I'll text you the location.
But don't tell me.
On the next episode of Elena's Ghost.
What's wrong with my daughter, doctor? Please tell me.
Why don't we just stop talking and keep looking, for the love of God?
Manages to throw herself on the floor. I don't know. I don't know how, but she only manages to do it when I'm not around.
No, this is our territory and we're the bosses in here.
That's what I thought. It's a mutation of the virus. And it's eating her up alive, that poor girl.
KBC, in collaboration with the Kenya Institute of Curriculum Development, is broadcasting enhanced out-of-class learning on radio, television and online. Catch the lessons every weekday on KBC Channel 1 from 2 to 4 p.m. on KBC English Service and 15 FM from 9:15 a.m. to 5 p.m. and Radio Taifa from 10 a.m. to 11 a.m. KBC English Service, Radio Taifa and 15 FM are also available countrywide on the free-to-air Signet digital TV platform, or log on to www.kbc.co.ke for live streaming or download the KBC online app on Google Play Store. Kenya Broadcasting Corporation, ensuring learning no matter what.
Next on Corner.
I shouldn't have taken inferior boxes.
That's nonsense, and you know it.
Then explain Dama's coma.
Nakani kama ninajali.
Sasa niko ready to fight. Niko focused.
Nisha cancel your fight.
It might take days before she wakes up.
What have I done? Is she going to die?
I need Dama to wake up from her coma. Honestly, Pamela, sometimes you just shock me.
Sorry.
Dem akwa coma. The first thing inafairan kwa mind yangu ni kucancel dinner.
Usijaribu kunifanya nikae heartless.
Welcome.
Ah, hello, madam.
I need to get to Elysium.
Whoever has this has the power to override their whole system.
Hey, bring down the bone saw!
This ain't gonna kill me. You can save everyone.
We're gonna break into the most heavily guarded place in the universe.
Oh, yeah. They will hunt you to the edge of the earth for this.
Coming to you in 5, 4, 3, 2, 1. On air.
It's not always about breaking the story. It's about checking the facts.
On News Check, we give you a panoramic view of events shaping the news in real time.
Let's do away with the everyday stories and deal with something that's more exciting. We're talking about the world of sport.
They say if you are not a decision maker, don't come to the decision-making table. On this check, it's different. We take you to the boardroom where decisions that shape the economy are made.
Kila kunapokucha unatazamia kupata habari tendeti za kina na za kuaminika.
Hivyo basi hapa umegonga ndipo. Tunakupeleka zinakojiri habari pindi tu zinapojiri.
Kumbuka, ni kwenye tamrini ya Channel One pekee ambapo unapata mijadala inayokuhusu wewe.
Next on
Never give up. Jesus loves you. Never give up. Gentle judges just
A-P-P-Y-H A-P-P-Y-H A-P-P-Y Happy, happy.
Everybody move to the beat.
KBC Channel 1 imekuandalia vipindi spesheli vya mwezi mtukufu wa Ramadhani. Kila Ijumaa tutakuwa tunakuletea khutba moja kwa moja kutoka kwa msikiti, ikifuatiwa na vipindi kama vile nasaha ya Kiislamu, kaswida, makala ya watoto na kutamatishwa na ukumbi wa Kiislamu.
Next on
Vile nilienda clinic nikiwa na mimba 8 months. Nimeenda wakanipima. Wakaniambia pressure imepanda sana na ni lazima tuokoe mmoja kati yenu.
Nilienda huko nikaadmitiwa. Wakafanyia mtoto test zote. Wananiambia they are negative. Haoni chochote. But mtoto ana convulse. Despite kumpea hizo dawa zote, mpaka daktari alisema aipewe dawa nyingine. Nimepewa zinatosha.
Yaani disability yangu nilipata nikiwa mdogo kabisa, kama sijielewi. Yaani tuseme nilijipata nikiwa naye. Lakini mzazi aliniambia ilikuwa polio.
'cause we're differently abled.
On the next episode of Elena's Ghost.
What's wrong with my daughter, Doctor? Please tell me.
Hello students, welcome to Form 4 Mathematics. Our lesson today is on statistics, and the topic, or rather the subtopic, is variance and standard deviation. Objectives of the lesson. By the end of the lesson, the learner should be able to, number one, differentiate between variance and the standard deviation of a data set. And number two, calculate the variance of ungrouped and grouped data. And number three, calculate the standard deviation of ungrouped data and grouped data. Introduction. Variance is one of the measures that are used to show how a data set is spread out. Consider the following two data sets. There is one data set of 18, another 18, 20, 20, and 24. There's a second data set there of 2, 10, 22, 24, and 42. Now, looking at those two data sets, let's take a scenario here where these are two students who did an exam, and let's assume that exam was marked out of 50. Then the first student, the lowest score they had was 18, and the highest was 24. If you look at the second student had the lowest score as 2, and the highest as 42. Just using that visual data without any calculation, which of the two students appears to be more balanced in their performance? Obviously, it looks like number one, although he's not hitting very high scores, he appears to be working almost at the average. But the second student seems to be a bit poor in one of the subjects where he scored a miserable 2, and the other one he managed a 42. If we work with measures of central tendency, where last lesson we discussed the mean, if we work out the mean of those two students, the two students will have the same mean, because mean is given by summation of the data points divided by the total points. So the mean of the first student is 20, and the mean of the second student is also 20. So this means if I reported the mean of the performance, then the two students are the same. But literally, we can see there are some performance differences in the individual subjects. And that is where we bring in the issue of how the data is spread out, from the lowest to the highest. And that one communicates more information than the mean. And therefore, our topic of interest today, variance or variation. When we are looking at variation, our interest is how far is that data point from the mean of the group. For example, if I was to look at the first student, if the mean of that student is 20, how does 18 vary from 20? How does 24 vary from the mean, which is 20? In the same way, if you look at the second student, how does 2 vary from the mean? That 2 is 18 points lower than the mean of the student. What about 42? 42 is 22 points higher than the mean of the student. And therefore, that explains more information than just working out the mean. Variance of ungrouped data. Suppose I give you a data set like 3, 5, 8, 11, 13, and 20, and our interest is to work out the variance. Then I'll proceed as usual, where I'll capture the X column, which is the data points, which is 3, 5, 8, 11, 12, and 20. Then the first thing I'll do is to work out the mean of that data. So if I'm to work out the mean of the data, I'll proceed as we agreed during our lesson 1. That mean is summation of x over n. When you add all those x's, the total is 60. Divide by 6. The mean of that group is 10. After we get the mean, we are going to create another column that is supposed to show us how far each data point is from the mean. And that is what we call the deviations. These deviations today, we can call them variations. Like the first student is minus 7 points below the mean, because we'll take 3 minus 10, which will give us minus 7. The second one will be 5 minus 10, all the way to the last one, which will be 20 minus 10, which gives us now positive 10. Now, if we try to add that column to get the summation of that column, the summation of minus 7, minus 5, minus 3, then 1, 3, 10. When we add that, we'll get 0. You can try checking out the sum. Minus 12, minus 14. Those are the negatives. The positives are 1 plus 3 plus 10, 14. Minus 14 plus 14 is 0. And that means now we are stuck. We can't move. So what is the solution? The solution here is to come up with a mathematical transformation that will remove the negative sign. And the mathematical transformation that removes the negative sign, is squaring the deviations. So if I square negative 7, I'll get 49. If I square negative 5, I'll get 25. Negative 2, 4, all the way to the last one. And that tells me now I've removed all the negative signs from my working. Once I've done that, now I am now ready to calculate the variance. The variance is given by that formula, and